of America brought together a session featuring founder of R.K. Devi Eye Hospital and Institution in Kanpur, India, Rotarian Dr. Awadh Dubey. The reputed ophthalmologist has been serving rural and underprivileged Kanpur for over 40 years and works with the Indian Development Coalition of America on Adopt a Village campaign dedicated to providing basic education and healthcare for the ones in need. The session was titled 40 Years of Rural Eye Care Services and Updates from Work Adopted Village but Not Only Poor, aimed at reaching out to Indian Americans for support and help. The event saw various community leaders and persons in attendance discussing social causes in India as introduced by the India Development Coalition of America. Dr. Awadh Dubey spoke on his experiences and urged for support for the untreated, unprivileged rural India. The event addressed the need for providing basic rights and necessities to the ones in need, especially in the healthcare region of India.
So actually, as we all know that India is a very vast country and a very populous country. Overpopulation and poverty, these two combined together, have led to India also having the maximum number of blind in the entire world. So it's a very long journey for any doctor or any organization. Government is working, but it's about 40% of the whole work, and the 60+% of the work is done by the NGOs all over India. And we ourselves are working for 4 decades. In 1978, I started my journey single-handedly. And now we have 3 main hospitals and 2 satellite clinics where our team goes every day and we examine the patients. Then we select them if they are found to have cataracts or other diseases which are operable. Then we bring them to our base hospitals and then we perform the surgeries which are free for the poor eye patients. Government of India at the national level is one of the few countries which has a national control for prevention of blindness program. But as I said, that such a vast country and so many people to treat, it's always a combination of governmental and non-governmental.
Private and government partnerships, how are they working now?
They are they are very sincere about this from the government side, but it takes long time to implement these things. At the same time, the non-governmental organizations like ours, we are working 4 decades, maybe some working more than that. So we have our own experiences, and as you said about the awareness, I also agree that awareness is the key for prevention of blindness. And 80% of the blindness is unavoidable in the beginning if it is treated at the right time by the right people and right way. So that's a very interesting point which you have raised.
Do come back to us.